everybody. I hope everybody enjoyed a good lunch. I'm ready to settle down. My first thing that I really need to do is just say how thankful I am and how excited I am to be here in front of all of you. Because I had the opportunity today to talk to you about an issue and a concern that has been a driving passion of mine for almost 20 years. And what this passion is that I've realized that what we need to do is we need to do more to help cancer survivors become cancer thrivers. And as I've tried to prepare for this, I've tried to think, how can I best explain why I believe this is an issue? And so I want to talk about just a story. And this story is one that I've heard many times. But it's also a story that I think is probably being played out even as we're here today. And so I want you to imagine, if you could, that it's that time of year for your annual checkup. And along with that checkup, quite often comes those tests that we have to do every year. And for those of us that are in our 40s and 50s and years, it's some of these tests that we really don't want to do. They're kind of inconvenient. They're not uncomfortable. But we know we have to do these tests because of the what if. So we go to those tests, and everything's feeling normal, everything's feeling good, you're feeling healthy. But the doctor then says, well, we need to do some more tests. You kind of say, why? It's like, well, we saw something. Not sure what it is, don't worry about it. It's probably nothing, but we do want to do a couple more tests. So you go and you have these couple more tests done, and a few days go by, a little nervous because of the what if, and then you get the phone call. And your whole world turns upside down because you've just been told you've got cancer. 1,000 things go through your mind. But the first thing the doctor says is, don't worry. We're here for you. We are going to support you. I am putting together a team of experts that are going to help you get through this. And then things suddenly go into hyperdrive. First call is from that cancer surgeon. So you go see the cancer surgeon. Puts up all these graphs and charts and films and studies, goes through an outline of all these procedures, all these options, these choices that you have to make that you know are going to change your life. You have to make these decisions in a very short period of time. This is not something you want to delay. So you have this surgery. Sometimes these surgeries are in very personal areas. And as these surgeries, the result of this is that it causes pain. It causes inability to move. It causes a lot of discomfort. And before you even have a chance to recover from this, now comes the next step. It's the next doctor. It's your oncologist. And again, you go and the doctor points out all these graphs and these charts and these studies and tells you what we're going to outline. And basically what he's telling you is that for the next couple of months, he's going to inject you with poison. Poison's called chemotherapy. This poison is designed to attack fast-growing cells, which is what our cancer is, which is a good thing. The bad thing is that it's going to attack all our fast-growing cells throughout our whole body. That's why some people lose their hair. That's why some people have problems with swallowing, with digestion, with balance. But we know it needs to get done. We know for our survival we need to do this, so we go through this. But the biggest thing is that they're by your side. Don't worry, we are going to monitor this. We are going to watch you. We're going to have people watching you all the time while you're sitting in that chair getting that chemotherapy. We're going to be running tests. If you're having too many problems, we're going to give you drugs to counteract these drugs. And you feel supported and you feel comforted, and that's a great thing because this is not something that we want anybody else to go through if we could. We get through that chemotherapy, we're feeling weaker, we're feeling more tired, but now we have another phase. And we meet with that radiation oncologist. And again, comes up more graphs, more charts. And what he does now is he's going to tell you that we're going to put you in an uncomfortable position for the next month, and every day we're going to zap you with what's called radiation. Basically, it means we're going to burn you. And as we burn you, things are going to get sore, even more sore, where they're already sore. It's going to make your skin raw. The toxins from the burns are going to basically cause you and make you feel even more sick. But you're going to get through it. We've got great technicians. We've got great doctors. We're going to help you through this. You feel comforted. You're almost done. And then that magical day comes when it's your last treatment. And everybody is there celebrating. Everybody is there with you. All these doctors, all these nurses, all these technicians, all these friends and family members that have been there by your side. And you get done, and the balloons come out, and the cheers come out, and you ring a bell to celebrate that you're done, and everybody says, great, we've completed all our work, we're done. And you look at it and say, wait a minute, I'm in the worst physical health of my life. And everybody says they're done. Everybody tells me that I should be celebrating. I should be happy I'm alive. I'm a survivor. But the worst thing is I've never felt so bad in my life. And I was just blessed that just a couple of days ago I got a chance to work with somebody, and she told me a story that I thought was very relevant to what we just said. And she said that while she was going through her cancer treatment, she felt like she was walking down this dark and scary path. But she was also walking arm in arm. On one side were all the doctors and the nurses and everybody there who were helping her. On the other side was all her family members and friends and caregivers on the other side. And she was walking down this path feeling confident. Then all of a sudden on her last treatment, it seemed like everybody let go and she fell off this cliff into this dark abyss of unknown. That's the issue. That's the concern. That's the problem that we need to solve. Now, how do we solve this? Well, all I can say is we've got a model right here on Hilton Head. This is the model that I want to spread. And it starts it starts basically with just recognizing that there's a problem. And that's what we're doing now. We are recognizing that we don't treat a patient like cancer by the numbers. We have to treat a patient based on their quality of life. We have to think not just of the cancer treatment, but we have to think of life after treatment. So how do we do that? We actually see patients now before they even start this journey. We provide workshops. We don't tell them just what's going to happen. We tell them what they can do after it happens. We give them a strategy on trying to improve their physical health right away. And if something does go wrong or something doesn't feel right, they know right away who to ask for help, and that help is provided. And what does that do? That empowers. That gives them, in a period of their life where they feel like they have no control, they now have a peace that they can hold on to. And so we empower them, knowing that they're going to debilitate, knowing that they're going to decondition. They still have that other piece that's there for them. The other thing that we do is we educate. Not just educating the patients, not just educating the family members, but we educate the caregivers, the healthcare providers, and the community. We let them know what can happen physically as a result of these treatments. We let them know that some of these impairments that this person may incur may not happen right away. They may not happen until months, years, sometimes even decades later. But the sooner we recognize it, the less of an impact on the life of that person is going to be. And the last thing we're trying to do is provide the resources. It's always been amazing to me in the 20 years that I've been working with cancer patients that we are spending millions, if not billions of dollars on the prevention and the treatment of cancer, but we're spending very little after the cancer treatment is done. So what we did is we started a not-for-profit. This not-for-profit is to provide wellness services so that after that person has restored a sense of normalcy, after they've gone through this treatment and have not accepted a normal or a sense of normalcy that's filled with impairments, they've now worked themselves to their highest level of sense of normalcy, to their highest level of quality of life, and now we help them preserve it. We provide exercise classes for free. We provide support groups for free. We provide nutritional education for free, for as long as they feel that they need it. And what you see is a transition. This transition of going from, should I celebrate, to a transition of, I can celebrate. And so we take a person from, I'm a cancer survivor, to now, I am a cancer thriver. And for me personally, I get this honor and I get this privilege of seeing it quite often. And the transition on their faces of going from acceptance to hope is so emotionally powerful that this needs to expand. We need to do more to help cancer survivors become cancer thrivers. Thank you.